Good afternoon. We're glad to have the press back again and the public if you're watching to our press conference. With me today is Commissioner Bob Harvey, Commissioner Jean DiGirolamo, Scott Forster from our Emergency Services Director, and Dr. David Damsker from our Health Department. We also have a special guest with us today, Grace Wheeler from NOVA. So we will be starting with Grace today so she can tell you about an important program. The three commissioners as well as the district attorney have joined together because we are saying not on our watch. There will be a stop to child sexual abuse, so we won't have that on our watch. So I'd like to introduce Grace Wheeler, and she'll be talking about child sexual abuse and stopping it here in Bucks County. So thank you, Grace.
Thank you, Commissioner Marsaglia. And good afternoon, everyone. I certainly want to just spend a little bit of time talking about this training that we are offering through NOVA and August 20th, which is going to be our Not on Our Watch Day. Before I do that, I thought I'd just offer a little bit of background as to why now. As we're having lots of conversations around children going back to school, and we're also thinking about the ways in which this pandemic has affected rates of child abuse, and particularly child sexual abuse. Nationally, we really feel that this training right now holds a particular relevance for adults in our community. Whether students are going to be going back to school in a virtual, hybrid, in-person setting, that is going to provide the opportunity for children to be back in contact with mandated reporters in those school settings, with their teachers and other school staff and faculty. We know that some students over the summer may have had some contact with mandated reporters, whether that be through camp staff or maybe see medical professionals, mandated reporters in places of worship. But we also know that some students may not have had contact with mandated reporters since they left that school setting in June. So back to school kind of holds particular relevance every year for children in Bucks County as they're entering those school settings again. We know that teachers in particular on a national level, they make up just under a quarter of all mandated reports. And this year, from the sort of March to early June period, we know that nationally there was a steep drop off in the amount of mandated reports. It was about 212,000 fewer reports this year. So we do know that with children not being in that in-person setting, that we have seen that most likely affecting those mandated report rates. Furthermore, we do know from our own Children and Youth Social Service Agency here in Bucks County that calls again from that early March period into June were down 50%. That's in keeping with what the Pennsylvania Secretary of Human Services has also kind of been reporting out. So we're kind of looking at this period and seeing what was decreased mandated reports in the spring, and then coupled with kind of what's typical in that students are not in contact with mandated reporters as frequently in the summer. And then there are some additional concerns. We know that this time of COVID-19 has been particularly stressful and for households and families when we're thinking about potential loss of income or housing instability, perhaps inadequate income, or just in general that social isolation can be very stressful. And so we're looking at most likely increased levels of stress in a lot of our households. And on top of that, we know that about 30% of all cases of child sexual abuse, the abuser was a family member. Not in particular, perhaps an immediate family member, but a family member nonetheless. So there's a lot of kind of concerns, but also opportunity. What we know is that with teachers making up a 0.25% of those mandated reports, that we as adults in the community also need to step forward right now and be those eyes and ears for children. We also know that, with this fall, with new settings for children's, maybe learning in pods or learning from home, there's going to be some new settings. And so also new prevention information can be helpful for families as well. So with that, NOVA's really, really pleased that right now we can offer a training to adults in our community members so that they can learn about child sexual abuse, and really, most importantly, learn how to prevent child sexual abuse and protect children. So for the past 2.5 years, Bucks County has been participating in a pilot project. It's a prevention pilot project. We were just one of 4 counties, or excuse me, one of 4 projects in the Commonwealth that was selected for this pilot project. So we have the privilege of rolling this out in our community. And this project was funded through the post-Sandusky litigation. And so that kind of has given us the funding to really take a hard look at what prevention looks like in our county. So we've been doing a couple different, we've been implementing a couple different strategies through this project, but the one that we're really focused on today is that community-based strategy. And that's our CSA Stoppers training. Through the project, we are looking to train 5% of the adult population in Bucks County, and that number falls to just a little under 25,000 adults in our community. We expect that when we reach that 5%, we will have hit what's considered a tipping point in terms of awareness, and then in terms of those sort of protective behaviors and prevention measures being put in place, so that we will see the rates of child sexual abuse drastically drop off in our county. We know that child sexual abuse is really a topic that thrives in secrecy and in silence, and it's certainly underpinned by a lot of taboo, and there's many myths around child sexual abuse. This training really provides the opportunity for us as a community to break that silence and have these conversations. And so, that is why on August 20th, we are having what is called Not on My Watch Day. This is an opportunity for all the adults in our community who have not done so yet to stand up and say, not on my watch. I will not allow the children in our communities and our county to be sexually abused. It's not on my watch. And so on August 20th, Not on My Watch Day, we will be inviting adults across all of our communities in Bucks County to sign up for a free CSA Stoppers webinar with NOVA. It's a free webinar. It can be done from the comfort of your own home. In fact, we try to hold trainings throughout all different types of times of the day, so that anyone can kind of join us, whether an early morning session or a late evening or during the day looks good for you. We will be there for those webinars and those trainings for you. There are a couple different ways in which, and I can see we have this slide up here, we have a couple different ways in which adults in our community who might be interested in learning more about this training are certainly interested in registering for this training. There's a couple different ways that you can get some more information. We have that text line that you see. You can certainly visit our webpage, or you can feel free to just email me directly, and I would be more than happy to help you register. And we really do hope that you tune in to NOVA on August 20th as we kind of talk more about all the ways that adults can get involved on Not on My Watch Day. And then hopefully we'll be seeing many, many adults in the coming weeks and months on our CSA Stoppers training.
Grace, thank you so much. Such an important issue, even more important while we've had so many people not in school and able to rely on their teachers and counselors for support. So thank you. I'm sure there'll be questions for you when we get to that part, but briefly, I was hoping Scott Forster could tell us a little bit about weather stuff, and that Dr. Damsker could give us a quick COVID update. Scott?
Thank you, Commissioner. I'd like to give an update on the storm that occurred last week, Tropical Storm Isaias. Last Tuesday came through the county, and it was almost like 2 different storms. The lower end of Bucks County received a lot of wind impact and tornadic activity, and the upper end of the county received a lot of flash flooding and heavy rains. So One of our greatest impacts during the event was a tornado. It was a tornadic thunderstorm that actually traveled for 20 miles. Not constantly on the ground, but it had started around the Franklin Mills Mall and proceeded up to the center part of the county and ended around Peace Valley Reservoir. It did touch down 3 different times that we were able to figure out with the Weather Service. The first one was in Upper Southampton Township. That location received an EF1 rated tornado with winds of 90 miles an hour. The second time was Doylestown Borough and Doylestown Township. They received an EF2 tornado with 115 miles per hour winds. And then the other area was more of a rural area north of the Doylestown area up towards Peace Valley Reservoir, where they received an EF1 tornado with 100-mile-an-hour winds. All the same storm, though, just touching down at different times. With that tornado came a significant impact to the Doylestown Hospital complex, where not only did Doylestown Hospital receive some minor damage to windows, light posts, vehicles, but the most significant impact on that property was the daycare center. Part of the roof was torn off, and another section of the building actually collapsed, the roof area. There was 135 children inside of that building. There was a handful, about 6 children that had minor injuries, and a couple of the teaching staff also received injuries as well. Out of that whole tornadic event, I'm so glad there were no serious injuries or life-threatening injuries that occurred. When we talk about the impacts to the upper part of the county, Quakertown, Richland Township, Perkasie, Sellersville, they all received about 7.5 inches of rain, when the lower part of the county only received at the max of about 2.5 inches of rain. So we had over 24 water rescues. We had multiple streets and some homes and businesses that were flooded. And, it was like 2 different storms going on. The lower end of the county responded with boats and water rescue teams to the upper end of the county, while all this was going on, and they were responding to their own wind impact events in the way of structural damage and trees and wires down and debris blocking roadways and so on and so forth. At the height of the event, we had about 102,000 customers out of power. That equated to probably somewhere around 300,000 people. We had over 50 roadways closed in the county. And as a result of all of those impacts, so far in damage reports that we received from the municipalities, we have about 50 residential impacts, and that includes single-family homes and apartments, and 10 businesses that have been impacted. Some of those have sustained major damage or are destroyed, and some of them just have received some affected impacts when you look at the damage on the scale. We are reporting all of our damage to the Pennsylvania Emergency Management Agency. We are doing it collectively as a group. When you look at the damage from southeastern Pennsylvania and the Lehigh Valley, we're hoping that all of the damage together will give us some kind of an assistance program that will help the residents, whether it be federal funding or whether it may be very low interest loans from the Small Business Administration. We are trying to do whatever we can to lessen the burden of the impacts on residents and businesses in the county. So we continue to work at that. We continue to work regionally as well as with the Commonwealth of Pennsylvania. Thanks, Commissioner.
Thanks. Dr. Damsker? You are muted, Dr. Damsker.
There we go. Sorry. We have mostly very good news. We obviously had our large spike earlier on in late April, early May. The numbers came down through June. And then, as we all know, once we moved to green, closer to the end of June, and then the 4th of July holiday, we had several weeks of a small upsurge in cases. The curve, it was less than a third of what our overall spike was earlier on. So it wasn't a true surge. It was just a slight increase. We know that happened again for people being in their homes for a long period of time, going to the beach, just being out and about for the first time, and all businesses being open. Those numbers have clearly come down now. We don't know how far down they're going to go, and it's really difficult for anyone to say. But we will have a baseline number of cases where people are out and about doing their thing as they are now, and there's going to be a certain amount of transmission in the community, and we're just kind of waiting to see what that baseline ends up being. What I can tell you, though, really importantly, is that despite that small rise in cases that we had over the last month, which is now coming down, our hospitalizations are down to a dozen or less, with 2 people that are in critical condition. And what that tells you is, at one point, we had 270 people in the hospital with dozens of people ventilated, 30, 35 people. And we're down to 2. And again, that's obviously horrible for those 2 families. But shy of that, the people that are going to hospitals now are going in, getting some oxygen, and getting discharged, usually pretty quickly. And it's really important to note that I think the hospitals have gotten better treating it. I think that people are wearing masks, people are following the rules, but our overall hospitalization rate is as low as it was before schools even closed in mid-March. So I think everybody should be really happy about that despite that surge in cases that we had, it has not impacted our hospitalizations. As a matter of fact, our hospitalizations continue to drop. We're hoping that soon we're down into the single digits in hospitalizations. And so we feel really good. And to me, that's probably the most important indicator of everything that we're talking about with COVID. Like I said, we are definitely on the downside of that. We went up really high, we came down, we went up a little bit, and now we're coming back down from there. So regardless of what you hear in other states or nationally, we're doing very well here in Bucks County. Thank you.
And I did not introduce our Director of Public Information before, but this is Larry King, and he is here. He would be happy, I am sure, to ask some questions that you have.
Thanks, Commissioner. Start off with some questions from Jim Melwert of KYW Radio. He would like your thoughts on the governor's strong recommendation that youth sports be put on ice until January 1st. What, if anything, has Bucks County's contact tracing found regarding cases revolving around youth sports?
Yeah, there's been a couple of cases on youth sports teams. They have been, of course, if someone goes down the shore or someone travels and they become sick or we get a household contact, those kinds of cases, are obviously always going to be around. And there's been a few cases on teams where someone was sick. Many times they didn't even practice with the team. They may have gotten sick, prior to going to practice, or they were on vacation when they got sick. And we've seen very, very little spread on a team. I think maybe one case total of spread on a team, but it's been very rare. And I want to give some credit to both the schools and the recreational leagues that have been putting these teams into play. They've taken it very seriously. They made sure the kids are doing all they need to do. The coaches are wearing masks, and it's not always easy, especially when some of the games are outside. But I do know that the recreational leagues, and I've looked at many of their safety plans, have taken this extremely seriously. And I do believe that they're able to, to do sports safely. I mean, it all comes down to, making sure the kids don't participate sick, making sure that they follow the proper guidelines. But, especially when you're outside, we know that that's extremely, much safer. I won't say the word extremely. It's much, much safer to be outside in general with COVID relative to playing sports inside. And even inside can be done safely if done properly. But, that was a comment that the governor made. And they've come out since, obviously, saying that it's a recommendation. It's not a requirement. Especially since a lot of sports have put a lot of time, leagues have put a lot of time, effort into putting protocols in place that would keep the kids safe. But no, we have not seen any real outbreaks at all from sports.
Okay, also from Jim Melwert. What does the county think flu season looks like this year, since we are taking a lot of steps to try to prevent the spread of a virus currently?
Yeah, I personally, I think the flu season is going to be minor because we're doing things today. And I've said this before in other contexts. We've never had a flu season before where people are wearing masks and social distancing and paying attention and not going to work sick and all the things that we've always done traditionally. We're doing the right thing now. So if we continue on the pace that we're on and doing the things we're doing, I suspect we'll have a fairly mild flu season.
Okay, and finally from KYW, also for Dr. Damsker, do you have any thoughts on the state's updated guidance for school reopenings? Is it helpful, and if so, how?
Yeah, it's interesting. I mean, the governor has said, the Department of Education has said for now, a month or 2 months, saying the school districts are able to maintain their own health and safety plan and to do what they need to do. And the new guidance it's just guidance. That's all it is. It's not a requirement that no one has to follow these numbers. But the numbers that they used, the metrics that they used, were basically the whole state. Looking at those numbers, most of the counties in the state don't fall under 10 cases per 100,000 over the last 7 days. So it's difficult to come up with a metric that basically flies in the face a little bit of the guidance that you've given to say you can do whatever you want to do if you can do it safely. But it's just a recommendation, and I think it was put into place especially for counties possibly that don't have a local health department, that don't have a city health department to help them make decisions. It gives them additional guidance. But in the end, though, that's what it is. It's a number that you can look at. And to be specific, for Bucks County, for instance, for us to meet that guideline, we would have to have an average of about 9 cases per day over a 7-day period. And we've never done that, even at our lowest, segment at the beginning of June. So I'm not saying we would never get there. We would get there. But as I said earlier on this press conference, I'm much more focused on the hospitalization numbers, the spread in the community, what's happening, than I am, an actual, whether there's 9 cases per day or 15 cases per day. Those numbers don't mean a whole lot to me in that context.
Thanks, Dr. Damsker. I have a question for Grace Wheeler from Joe Chevalier of the Courier-Times. She was wondering if you could talk about participation so far in the CSA Stoppers Program. Particularly, how many people have you been able to train thus far?
Absolutely. So to date, we have trained a little over 4,000 adults in our community. I should note that certainly this was a project that was, as I mentioned before, a pilot project. And so in our first early stages of implementation, there was a lot of sort of laying the foundation and groundwork and getting things up and running. And we've certainly kind of found our pace with these trainings now. And certainly since we have shifted to this live webinar format since March, we've seen increased interest and participation in that period of time from about end of March into early July. We had trained over 1,000 adults in that period. So we're really excited to see the interest in this training as a live webinar format.
Thanks, Grace. Dr. Damsker, from Tom Sofield, some questions regarding contact tracing. He was just looking for an update about how the county is doing with its contact tracing, what percentage of infections you have been, people infected you've been able to successfully contact, and whether you're meeting with any increased resistance from people who don't want to talk to you for whatever reason.
Sure. We have done, as everybody knows, we've done extensive case investigations since the beginning of this, and we're at about 95.4% of contacting all of our cases, which is really good, and that's enabled us to get the case onset date for all of our cases, which is the date the symptoms first started versus the date that the case was reported. And I mentioned a few minutes ago about the governor's metrics that he put out into place. And that's by case report date again, not case onset date, which is a much more accurate way of doing it. But so what that does is that allows us to have a really strong grasp on what's going on here in Bucks County. Now, to answer the question specifically, recently we have seen a little bit of an upsurge. Not huge. We're still getting the vast majority of people, but there's been a few more people we've contacted that either won't call us back or has said, they'll give us basic information about themselves, but may not give us all the information that we need to fully trace, their exposures. We encourage everyone to speak to us. There's been some issues, people worried about scams, and, we'll never ask you for any financial information, social security number, anything like that. We're only interested in your onset date, where you may have been, and you can always call the health department back if you're not sure it's us calling you. We want to make sure everyone feels comfortable speaking with us. I think part of it is also because, they may have gone to a party, they may have done something, and they don't feel comfortable, sort of dropping a dime, if you would say, on their friends or family where they were somewhere they may not have been. Our idea, we're not getting anybody in trouble. Our contact tracing is purely to help the community get our numbers down. Because in the end, we want our businesses to be fully reopened. We want our schools to be reopened. We want our society to flourish again. And the way we do that is through strong case investigation. So, no one's getting in trouble. All we're doing is we're letting people know potentially that they have coronavirus, that maybe the sinus infection they think they have, or the allergies they think they have, or the cough they have, they might not know they were even exposed. And that might make them, hey, I better stay home from work. I better go get tested. And all that kind of information, if we have it and we're able to communicate with people, it gets the overall numbers down. So yes, we are seeing a small increase, and we saw this again after 4th of July, and we're seeing it again now. We want to encourage people, if you're not sure it's us, if you're afraid to talk to us, call the health department back, and you can verify that it is the health department calling. We will never ask you for any piece of information that's not related to your illness. And we encourage everyone to please give us a call back. Please speak with us. We are not here to get anyone in trouble. It's just to keep the levels of coronavirus down in our community.
Okay, and following up on that with you and or the commissioners on contact tracing, can you talk a little bit about the nearly $900,000 contract that was approved at yesterday's meeting to hire temporary staffing to assist with contact tracing? Why was that needed, and how many additional contact tracers will you have at your disposal as a result?
Yeah, we've done basically this entire response by ourselves here at the health department when it comes to, we've done it all internally. And it's been a long time. It's been doing this for 6 months. I think it does get to be very difficult on people. We have other programs that we have been neglecting. We've had people that are tired. We've been doing this 6-7 days a week. And what we need, it's not that we can't do it on our own. It's that we need additional staff so we can actually begin to plan for instance, if there's a coronavirus vaccine, our department may be responsible for getting it out. It's very difficult to do case investigation and plan for future situations. So we're hoping to be able to not only get back to some of our normal programming, at least part of the time, and allow people to maybe take a vacation, but we're also able to plan for additional COVID-related things that right now it's difficult to do. We're hoping to hire probably 8 to 10 people, maybe a few more depending on the roles. Or maybe bring a few people into work in our call center. We still get many calls every day for the public, so we can still answer those questions, as well as take over some of our case investigation duties. And we're hoping that this money, we're getting money from the state government to do this work. And we feel that it's good to have a couple people in reserve and able to do this work full time, such that our staff is able to, also be able to do some of the regular work in addition to, be able to plan for additional coronavirus response, because there will be a vaccine at some point. And if it goes the way it did during H1N1, the entire responsibility for that vaccine was placed on the local health departments to help distribute that vaccine. So we have to be prepared for that.
I would just like to add that I want to thank you and your staff, Dr. Damsker. You have done a yeoman's job trying to get all that contact tracing done. And I think we're pretty unique in the state of Pennsylvania and how we did with that. Anybody else on contact tracing? Okay, Lara.
Okay, question from Frida Savannah of the Bucks County Herald. She's wondering whether the county did move ahead with buying face shields for school children in Bucks County. And if so, how will they be distributed with the growing number of schools being all virtual at the outset? or is there another strategy being considered?
We'll let Scott Forster answer that, but we are going to go ahead and purchase them if they haven't arrived already, and kids are going to go back to school at some point, and so they will still be useful. But Scott?
Thanks, Commissioner. What Commissioner said was correct. We have already purchased just shy of 200,000 face shields, 2 different sizes, one child size and one adult size. And we are expecting them to come in over these next couple of weeks. They are not in yet, but we will be distributing the shields to the schools and the districts that are going to do in-person and hybrid training first, and then we will get the shields out to the districts that will do online education, because eventually the students will come back, and so they will need some level of protection against the virus.
Okay, thank you. Finally, from Alex Gross of DelawareValleyNews.com. Also, I guess for Scott, what did the county learn from this storm as a way of preparing for the next? And also, what was the longest anyone was without power?
So the power question, I believe the answer is all of the customers were restored on Saturday. So from Tuesday to Saturday is a pretty long time. There's many things that we learned as a county, and that's that we all have to work together. And this storm showing 2 different types of significant impacts, really showed the need that the upper part of the county and the lower part of the county have to be able to support each other when 2 different impacts are going on. And we were able to do that.
Can I just comment real quick? And I know because of the storm, there were a lot of people without electric, and the ones that did not get electric till maybe Friday or Saturday, I think were kind of like people where there were isolated instances where a tree had fallen on a wire, and maybe only 1 home or 2 homes or 3 had been without electric. And I know throughout, people without electric, and I've experienced it myself at my home, not this time, but in the past, and people really kind of get angry at times with PECO because they feel like they're not responding or coming out fast enough. But I would just like to give a shout out to PECO because I think they really did a terrific job last week with this storm. They called in a lot of different help from different states that came into Bucks County and help out restore electric. So I would just like to give a shout out to PECO, and I know some people get angry, but I think they did the very best they could in making sure that everybody got their electric back on.
Thank you. Larry, any other questions?
No, Commissioner, that's all the questions, so I'll turn it over to you for any closing remarks.
Commissioner Harvey, did you have any remarks you'd like to share?
I just want to echo Jean's comments, certainly, and also Scott's about how the county did work together. You have people from the electric companies themselves, PPL and PECO, as well as first responders, and the situation I highlighted yesterday at our commissioners meeting about the daycare center that was hit with a tornado that took a direct hit. And they didn't have a warning. They didn't have the alerts go off on their phones like a lot of people I know. I had one go off earlier in the morning when I was still at home before I even left to come to the county to work. And they admitted that they had seen that too, but hours and hours later when the tornado hit, there had been no warning. And so it was really only the quick actions of the teachers and staff in that daycare center that really did save the lives, not only their own lives, but the lives of many, many children. I thought it was sort of asking, I was talking with some of the teachers about the kids and how they managed and how they did. And I thought, remembering, of course, these are preschoolers and kindergartners, many of them, that it was, it was kind of a good sign, a good reminder of how, I guess, durable and flexible, children are, that they were very, very afraid, very, very scared. And then when the police cars showed up and the fire engine showed up and the school buses showed up, and they got a chance to get sort of rides in the school bus and they got a chance to get carried by a firefighter or by a police officer, all the children immediately forgot about the tornado. So it was a good, I guess in some ways, thankful that everything worked out well, thankful for the teachers and everything they did in that preschool, and a good sign for all of us that sometimes, working together, cooperating, can help carry us a long way.
Mr. Rogers always said, look for the helpers. So those kids got to see that early on. Jean, did you have any comments?
Just real quick, and I'll touch on maybe just a little bit on everything. I want to thank Grace for being here, and all the people and the staff and volunteers at Nova, and especially with this program, Grace. It is so important. I mean, and I think I got a lot of forgiveness in me, but I'll tell you what, I have very little, if any, forgiveness in me for people who would sexually abuse a child. And anything that we can do to get that message out, that, letting adults know what to look for, getting that message out, and making sure that it doesn't happen ever here in Bucks County is extremely important. So thanks for your good work that you're doing. And again, I just want to echo what Commissioner Harvey just said about the incident last week at the tornado and the daycare center at the Doylestown Hospital. And as I said at the commissioners meeting yesterday, the staff at that daycare center and the people, the teachers who were in there, in my mind, are heroes, because they really made sure that those children were safe. They put themselves in harm's way. 135 children in there, and there were, again, as Scott said, there were a couple minor injuries, but nobody got seriously hurt. And in my mind, they are really heroes. So I just want to give them a shout out. And again, to what Dr. Damsker is talking about and where we are here in Bucks County, Doctor, thank you for the great work you and your staff are doing with the Department of Health. I think we've done a pretty good job of managing it here in Bucks County. We are in a pretty good position right now, I think, but I just want to remind everybody that we still have to continue to wear masks and practice social distancing. That is so important. If we're ever going to get down to a level where schools can reopen and all the businesses can reopen, I mean, we're going to have to continue to wear masks and practice social distancing. That is really, really important. And the one industry I'm a little concerned about here in Bucks County, which I think some of these restrictions could be relaxed a little bit, is the food and restaurant industry. I know they are really struggling. Inside, the requirements for inside have been reduced to 25%. I really believe that could be lifted and put up to 50% if we do it the right way. I know that the people who are at the bar has been stopped as well. And maybe even if we continue to do that, but I really think our restaurants need a little help. And I think they could open safely at 50% right now if the governor would allow that. So that's what I'd be looking for. And I think we can do that very safely. And with that, I'll turn it back over to Diane.
Thanks. And thank you, Grace, for being here. In just about a minute, we will put up your screen again with the numbers so people who didn't write it down before can. I just wanted to say something very quick about masks. Yesterday, I was on the cell phone, went into PetSmart. I was not paying any attention, and I didn't have my mask on. And as you all know, I think I'm the mask police most of the time. So one of the young employees said to me, "Ma'am, do you need a face mask?" And she said it so kindly and so gently that I was mortified. But when I got past that, I was so grateful that she had the courage to say something to me. I did call the store today and tell her manager, because we all need to do that a little bit. It was an accident on my part, and that happens. I'm sure everybody's done that once or twice now, gotten out of their car. But thanks to her and thanks to everybody who's helping us all remember that we need to keep each other safe during this time. So we'll put up Grace's numbers right now, and thank you again. Thanks everybody for being here. We're going to leave this up as soon as it gets there, even if we're not talking, for about 15, 20 seconds. Eric, do you see it? There it is. Okay. Take good care. Thanks, everybody. Be safe.
So long.